Doesn't come. Okay. Thank you very much, AIS, to giving this opportunity. I'm just carrying on what Dr. Prihar has already formed the foundation for that, for the blindness in glaucoma. We know it's a global problem and the second largest cause of the irreversible blindness worldwide. And currently it is expected that 12.3% of the blind pupils are because of glaucoma, and it's an increase. That is the matter of concern. If we look at the Indian scenario, the problem is again it's a major cause of the blindness in India. And what are the challenges basically we are facing in India, and how big is this problem is going to be in the coming years? So we have to fight the glaucoma both at an individual levels and at community levels. But the perspective of in these two scenarios changes. At individual levels, we may have problems to tackle with the progressions. We have to take with the care of the compliance and adherence issue of the therapy with the individual patients, and we have to take care of the cost of therapies. But at community levels, what is more important is to detect the patient in the time, at the time, and then have to make a correct diagnosis and make a treatment available in reach of each and every person. So to do this, we have to take a important note that India's population is on increase, as well as the life expectancy is increase. Giving an estimated prevalence of the 3% of the, glaucoma in India, so we have a huge number of cases of glaucoma-related conditions in India. So what are the problems now, right now? So we have an increasing population with an increasing life expectancy and a large prevalence of glaucoma. So what are the solutions? So we have to increase the case detections at clinics as well as in the community. And what are the challenges we are going to have? We have a problem with the awareness about glaucoma. We have the lack of the screening programs, and then we have the issues associated with the adherence with the therapy. If we look at the glaucoma awareness in India, we found this awareness and the population-based studies somewhere between 2 to 8% or 18% in recent studies. And in clinic-based studies, we have an awareness level of nearly 27%. If we look at the role of this, how we are spreading the glaucoma awareness, we did a study and we found that what is presumed that the media and the hospitals are playing a good role, but we found that it is very, very less. When we did the study on the awareness, what we found that the most important case in the glaucoma-related awareness was the acquaintance of the patients. So can we use these acquaintances to spread our message? Probably yes. But if we look at that media, we have got a large, wide reach of the media to the populations. Are not we underutilizing this? So we have to utilize all this media, print, as well as the TV and the radios to increase our awareness levels. When we go for the clinics, we have got the opportunity. Glaucoma being a slow disease, we have it is a spectrum of disease, both in case of primary open angle as well as the angle closure glaucoma. It passes through a stage. The only thing is that we have to diagnose the patient at the right time so that we can intervene. Remember, primary angle closure is the only condition in eye where the blindness is preventable, provided we detect the patient at an early stage before the optic neuropathy. So the problem of the diagnosis is the one which is to be tackled at the clinic, and we all know that nearly 50% of the glaucoma remains undiagnosed. Despite that, the patient has already paid a visit to an ophthalmologist. Then the problem of the overdiagnosis and the erroneous diagnosis is also very significant. So what is the reason behind this? That is, single reason is that there is a lack of comprehensive eye examination in most clinics. And what we require to improve it, we just require a 5-step comprehensive examination, which starts with your 4-mirror gonioscopy, go with Pachy, applanation, slit lamp, and the visual fields. So whenever we encounter a raised IOP, what we need to know, we need to understand what is the mechanism of the raised IOP. Is it an open angle or is it a closed angle? If you differentiate at this early stage, probably just YAG PI will prevent a blindness in case of angle closure diseases. And adherence and compliance, we know that the various population-based study as well the clinic-based study has found that the patients usually lack that compliance and adherence in their therapy. And also the studies found that a good communication between the doctor and the patient can reassert this and can improve the adherence and compliance issue. So recapitulate the challenges at the community. We have got a populous country, low level of awareness, lack of comprehensive examination, and some certain socio-economic issues. And to overcome this, the strategy we need to build is that we improve the awareness, we do the opportunity screenings at our clinics, and thrust on the comprehensive eye examinations, and have a better communication with the patients to improve the adherence. Thank you very much for your kind attention.